Dr. Nikki, and I run a private clinic called the Female Health Doctor Clinic. And welcome to this next episode of my YouTube channel series, which is all about dry vaginas. It's a really taboo subject, and it's just something that we don't talk about, right? It's embarrassing. So, what I want to do in this episode is talk to you about what this condition is, what sort of symptoms you might get from it, and how you can help it. And of course, as always, if any of this resonates with you, then please feel free to comment, subscribe to my channel, and come and see me in the clinic where I can help you with your symptoms. So let's start us off. Dry vaginas. What is it really? So there are lots of women that are affected by this. It's not just menopausal women, but I know once upon a time, if someone said dry vagina to me, that would have been the first type of woman I would have thought of. Yes, it's a big group of women that are affected by this, but it's not the only women that are affected by this. So the sorts of symptoms that you might get, obviously dryness is one of the obvious things. So we get a lot of vaginal discharge every single month as normal part of our cycles, but you might start to notice that fluid that you're producing starts to become drier, or it might go completely. So that's one sign. Another sign is that you might start to feel soreness down below or itching, and that can really get in the way of being able to wear certain things, concentrating during the day if you've got a lot of itching going on, sleeping at night, the itching can affect that. And the soreness can really impact on your relationships. It can really impact on you being able to have sex with anybody or even with yourself. It's really difficult when you've got a really sore, dry feeling vagina and vulval tissue. So vulva is the lips on the outside, the vagina is the flesh on the inside. So it's important obviously to get our terminology right as well, because you might notice that your symptoms are different in different areas. So we've got dryness, soreness, itching. What else might be there? Well, you might also notice that you've got perimenopausal symptoms. So you might feel hot flushes or anxiety, or you might feel fatigued, or you might feel that you've got brain fog. All of these things can indicate that perhaps perimenopause and menopause is the obvious thing that might be causing this. Menopause is really easy because that's after you've had no period for 12 months off of contraception. But what if you're not perimenopausal, but you're still suffering? Well, ask yourself, what else is going on? Are you breastfeeding? So there is a proportion of women, in fact, a proportion of women apparently who are breastfeeding, 43% of breastfeeding women are struggling with this, which I think is incredible. It wasn't something that I was even aware of until I started, looking into this a while ago. The other thing to think about is what contraception are you on? So actually contraception like the depo, which is the injection, can be related to dryness. So actually you've got 42% of women who say that they experience vaginal dryness when they're on the injection. So look at your contraception. That might be a clue as to what's going on. But the biggest overarching group of women that suffer with this are those who are in the postmenopausal stage of their life. And up to 80% of women who are in the postmenopause can experience what's called GSM, so Genitourinary Syndrome of the Menopause. Now, they don't just have the dryness and the soreness, but they also have recurrent urine infections as well. And it's been predicted that if we were to just give vaginal estrogen to all of those women, then we would halve the amount of urinary tract infections and severe consequences of that overnight. I mean, to me, that just blows my mind. We would reduce the number of people needing to go to A&E for support with this, and it's something really simple, a tablet or a cream. Unfortunately, less than 10% of women are actually being treated for this, and a lot of the reason is because they feel too embarrassed to bring it up with their doctor. So if you're watching this and it's something that you're struggling with, then please bring it up with your doctor. Don't be embarrassed. This is something that they need to deal with, and it's something that you need help for. So don't feel embarrassed by that. But yeah, unfortunately, only around 25% of women that struggle with this actually seek help. So that means there's 75% of you who are really struggling with this, and you need support. So of course, you can come and see me in clinic. I'm very happy to see you. But I would recommend that if you can't come and see me, that you go and see your GP or maybe your nurse or someone at your GP surgery, where you can get some support for this. It's really simple. We're going to go through the treatments in a bit. So basically, it's common, right? So we've talked about symptoms, we've talked about the people that are affected by this. So now let's talk about the medication that we use for it. So the first thing is to think about ways that we can do this without medication. Now, I'm not saying this is the only way you can treat it, but it's something that you can start doing straight away. The first is using vaginal moisturizers. Now, you can buy vaginal moisturizer very, very easily from chemists and pharmacists and online. I like a particular brand called Yes VM. I just think they've really thought about their product. They've really thought about the women using it, and they're very supportive to healthcare professionals as well. So when I want samples for my patients, they're very happy to send them to me. So I really like their website. It's a great one. So look up Yes VM on Google and you will find it. But I'll also put some comments in the show notes for you as well. So that's the first thing you can do. Now you've got different moisturizers by different companies. Yes is only one brand, but there are lots of other options. So if you're not getting on with Yes, then you could try other things. Some people swear by things like coconut oil, and you can buy that quite happily from the supermarket. Again, everybody's different. You might not feel comfortable with that, but if you do and you want something more natural, then oils and things can be really helpful. So things like almond oil, coconut oil can be helpful. Just be careful you're not allergic to them, though, of course. We don't want to make things worse. So that's your kind of non-hormonal go-to. Now, for sexual intercourse, I would always recommend somebody use a lubrication. Now, that doesn't matter whether you've gone through the menopause or not, everyone should be using lubricant. There are water-based ones and there are oil-based ones. Now, water-based ones are condom friendly. So if you are still relying on contraception and it's condoms, then absolutely make sure you go for the water ones. If you are not and you don't need it, then you can go for oil ones. But actually, the best combination is using the two together, because the oil and water repel, but that also helps having sex, basically. So yeah, go for those kinds of lubrications. And again, Yes VM do those kinds of things as well. They do oil and water-based ones, actually do kits that contain the two, but there are other brands out there as well, of course. So just make sure that you go and have a look around and see what else you can find. So that's your kind of non-hormonal route, I guess, or non-prescription route. But it's also important to make sure that you address your lifestyle and make sure that you're not using things like FemFresh, for example, or anything perfumed that says that you need to use it for your vagina to freshen it up. You do not need to use anything down there other than water. And even then, don't douche, because a lot of women use water jets and things like that to clean down there. You don't need it. All you're doing is stripping away the bacteria that's down there naturally when it's already struggling, and then you're causing more of a problem, more itching, more dryness, and potentially even thrush or bacterial vaginosis as well, which is not pleasant. So avoid excessive washing, avoid anything perfumed, avoid using synthetics down there as well. So making sure cotton underwear is a thing that you do every day, nothing synthetic needs to go down there at all. Even down to things like panty liners. If you can, try and go for cotton-based ones, because some of the more synthetic ones don't breathe very well, and then that can lead to more problems. So the other part of this is not just about what you do down there, but it's also about how you are generally in your own body. So if your mental health is not great, that's going to make soreness and itching worse. If your sleep is not great, it's going to make itching worse, but itching can make sleep worse. So it's a vicious circle. But trying to address those simple things will also make you feel more resilient to be able to cope with the symptoms. Also making sure that your diet's very good as well. So avoiding processed foods, making sure that you're having plenty of good fats in your diet. All of this can all help with the itching and with the soreness and the dryness. But saying that, really, especially if you're in the menopausal phase, but anyone that's struggling with this, for breastfeeding or contraception, you can use vaginal estrogen. And that brings me on to my next topic of conversation, which is around what can your doctor prescribe for you? Now, some of these things you can actually buy over the counter, but you will be restricted on whether you can have it or not. So if you are over the age of 50 and you're in the menopausal years, then you should be able to buy vaginal estrogen over the counter from places like Boots or Superdrug quite easily. But they'll have strict criteria about whether you can do that or not. I tried doing it once purely for myself as an experiment, and I was rejected. They wouldn't give me the prescription. So you may be lucky, you may not be lucky with that one. So if you do need a prescription for it, then you just ask your doctor or your nurse or whoever's prescribing for you, you need a vaginal estrogen. Now, there are different types that you can go for. There's pessaries, so little tablets you can put inside, or little creamy bullets that you can put inside the vagina. There's creams that you can put both inside and outside the vagina. I quite liking both the pessary and the cream together, because then the lady can use cream on the outside and then the pessary on the inside, so that can happen. There are also other hormones as well that don't just contain estrogen, but there's something called DHEA, or Intrarosa is the brand name. And that breaks down into DHEA, into testosterone and into estrogen. So that the additional input of testosterone can also really help to improve vaginal dryness, particularly if you are resistant to just estrogen on its own. So if you're struggling, you've already tried all these things, it might be worth giving Intrarosa a go, because the patients that I've had that have got on with it have really got on with it very well, and it's made such a big difference to them. So they're your kind of hormone type things, as well as obviously being on things like HRT. So if you are in the menopausal years, going on HRT is really, really helpful. But clearly, if you're breastfeeding or if you're on contraception, you're not going to need HRT per se. It's more the vaginal estrogen and moisturizers and lubricants that you need instead. And then if you've got a lot of itching, what I often find really helpful is to use a very high strength or potent steroid cream. Now, specifically, this is helpful if you've got a condition called lichen sclerosis. It's another cause of itching around the vulva and vagina area. So it's always a good idea, if you're really struggling with itching, particularly at night time, is don't assume that it's just dry vagina that's doing it, but also have an examination just to make sure it's not something called lichen sclerosis. And this is an autoimmune condition, essentially, where you've got inflammation around the skin. They don't really know why it happens. It can cause kind of like a hardening or a whitening of the skin down there. It can fuse the labia together. It's not pleasant, and it can cause a lot of itching. And also, in some rare situations, can also lead to cancer. So it's a good idea that to get yourself checked. If it's there, get it treated for sure. But I often find that while someone's waiting for their estrogen to build up and work, you can use a bit of steroid cream just to get the itching out of the way, and then it all settles and everything's okay. So steroid cream, potent steroid cream, another option that can be tried. So they're your kind of prescription-based medications. And it's important that you have a chat with, your doctor or your nurse about it, because, it is really important that you get support for this. Don't suffer in silence. So then it brings me on to, what are the alternatives out there for this? So there are other alternative treatments now that are coming through. So there's one called ospemifene. I don't know if I'm pronouncing that right, but it's what's called a selective estrogen receptor modulator. So what it's doing is it's specifically concentrating on the estrogen receptors within the vagina itself. It's licensed in the UK for women who have completed their breast cancer therapy. But the problem is that there isn't really a huge amount of long-term safety data on it, so you do have to discuss it with your healthcare practitioner, so your oncologist or your breast specialist. And vaginal estrogens can be used by women who are going through breast cancer treatment or have completed their breast cancer treatment. It's not seen as a problem anymore, because the amount of estrogen that goes through into the bloodstream is negligible. And even if you were on something like tamoxifen, the tamoxifen would deal with would deal with any escape bits of estrogen that happen to make its way through into the circulation. And it doesn't have the impact on the uterus like HRT does. And estrogen that you take orally or have on a patch or a gel on your skin thickens the lining of the womb up because it's more potent. So you need to have progesterone alongside that. That's not the case for vaginal estrogen. So you don't have to worry about whether or not your womb lining is thickening. And equally, as I've said, if breast cancer is a worry for you, then you don't have to worry about that either. So I don't know if there's much of a space anymore for ospemifene, but it's an option. It's out there. And then you've got laser treatment. So I didn't know very much about this, but I thought it was quite interesting. So there was one I found, it's called Mona Lisa Touch. There are different options, but this one is it's a CO2 laser. And what it does is it's gentle, so it's not going to cause significant pain or anything if you have it done. And it causes the little micro lesions within the muscle lining of the vaginal walls, and it triggers new collagen formation. And so that it helps to improve symptoms of things like prolapse, which can be associated in the postmenopausal years, but also can help with creating more moisture down there as well. So they call it mucification, which I thought was really interesting, that just some laser treatment can do that, but that is apparently something that can happen. So it's worth exploring that if it's something you want to go for. If you have private health insurance, you may be able to get it privately, but if not, of course, you'll have to pay for it privately. But yeah, I thought that was really interesting and definitely something to explore. Um, so there we go. That's kind of a rundown of dry vaginas, what you can do about them, what your GP or your healthcare practitioner can do to help you with, and some of the things that you can explore yourself. And I will put lots of resources for you in the show notes so you can have a look at those yourself in your own time. But if you need a prescription, or if you feel that you just want to talk it through, by all means, please book in with me. I am here ready to help, and I would love to see you in my clinic, whether that be on video call or in person. I'd be very happy to. So there we go. I hope you enjoyed that this week. And yeah, I'll catch you again for another episode on women's health. So there we go. Take care, and I'll speak to you soon. Bye.